Hello, everyone. Welcome to the RFAMD podcast. I'm your host, Philip James, and today's guest is Dr. Erivelto Volpi from Sao Paulo, Brazil. Dr. Volpi, welcome.
Thank you, Felipe, for the invitation. It's an honor, and I'm very happy to be here.
Well, it's an honor to have you here. And for those listening, Dr. Volpi is a head and neck surgeon in Sao Paulo, Brazil. And Dr. Volpi, question for you. Tell us about your background. Why do you do what you do? How did you become a surgeon? Did you know you wanted to be a surgeon when you were a little kid, or how did it happen?
Yes, always, since I was a kid, I want to be a doctor, to participate team of head and neck surgeon, and I was enchanted about the world of surgery. So, so for this, I decided to do surgery, specifically head and neck surgery. So this is why I go to this path. I went to this path because I want to perform surgeries, specifically head and neck surgeries.
Well, it's an honor to have you here. And a little background for those listening or watching. Dr. Volpi's performed approximately 8,000 thyroidectomies, thyroid surgeries in his career, which spans more than 30 years. And he has also treated approximately 400 patients with thyroid ablation, which means no surgery. Are those numbers right, Dr. Volpi?
Yeah, I have almost 35 years in practice, and I performed these numbers. These numbers are correct. It's it's amazing, but it's correct.
What a career. We're looking forward to hearing more about the details of all your experience. But before we get started, why did you become a surgeon? And give us the evolution. Did you know you wanted to be a surgeon since you were a little kid? Just give us a little background about why you do what you do.
Wow. Since I was a kid, very early, I decided to be a doctor. And when I started my medical course, I was invited to participate in a surgical team as a scrub, like a scrub nurse or something. And I started to participate in surgeries and surgeries and surgeries since I was a student. And I decided to go to this path. And I start to work with a head and neck surgeon that invited me to participate in his surgical team. And after many times in head and neck surgery, I decided in thyroid and parathyroid. So it's a long time on this way.
So you actually, when you went through the university, you knew immediately you wanted to be a surgeon.
Yes, at the end of my first year in medical school, I start to study uh, uh, more deep anatomy, specifically neck anatomy, because I was invited to watch a thyroid surgery, and I was enchanted by the neck anatomy for the details, for the how delicate is this kind of medical students related to research, and I keep on this way and study more and participate in more surgeries and follow this surgeon. And well, was as a consequence of this, I became a head and neck surgeon.
Any regrets? Are you happy you chose
Wow.
this career?
No, I'm very happy. I'm very proud to be a head and neck surgeon, and it's an honor to me. Honestly, it's an honor to me when a patient decided to give me the honor to take care of his health and count on me to solve his problem.
Well, Dr. Volpi, the topic of this interview is to say no to thyroid surgery.
Yes.
And there's a lot to that, but before we get in deeper to the topic, let's identify what thyroid disease can be treated with ablation.
Well, it's a very interesting question. As you told, we performed in our practice more than 400 thyroid and parathyroid ablations, and since we started, we expand the indications. But of course, as you get more confident in this kind of treatment, you can help more patients to avoid surgeries. Nowadays, the vast majority of benign disease we can treat, benign nodules we can treat by radiofrequency ablation or microwave, but in our practice we use much more radiofrequency ablation. Now we treat almost all benign thyroid nodules. We can offer the possibility of radiofrequency ablation. For initial cancers, we have a very good experience in radiofrequency ablation, very few doctors. And when I saw his presentation, I started to think, wow, it could be a good option for some study, and I visit other centers in Europe that perform in a beginning to study. And the most interesting was that when I start to perform radiofrequency ablation, I think that the patient wants to avoid surgery. So ablation will be an option should the patient avoid surgery. But what impressed me, impressed was that the patients many patients don't want to avoid surgery. The first reason for many looking for radiofrequency ablations was about their quality of life. The patient told me, "Oh, doctor, you are that the chance of any major are very, very small, but I don't want to take pills for the rest of my life. I want, because the function of my thyroid is normal. I have a good quality of life, and my friend or my sister or my mother take pills, and her life changed a lot after the surgery because he's not adapted to the use of hormones. And I want to avoid hormones in my life. I want to preserve my quality of life." It was so impressive. It caused an impact in my mind because I had a surgeon mind, and it's different from the patient. It's interesting how to have to balance sometimes what the surgeon, the judgment of what is the better for the patient sometimes is not the patient think is better to him. So the radiofrequency ablation, this new treatment, opened my mind to offer to the patients many options to solve the problem of the patient. And it's caused a big impact on how I see the nodules or how I can treat these nodules. And it was amazing how many patients have a very good quality of life of after ablation, because their nodules shrink. his thyroid function is preserved, and the patients are so happy, and it's interesting.
Dr. Volpi, look around the world, you know a lot of thyroid ablation doctors. Can you cite one case in particular that was most awe-inspiring? Either you performed it or somebody you heard about performing it that really got your attention?
Yes, there is a case that it's a very good example. I have a patient. It's a 70 years old lady with a nodule. Is growing during the years, and he was very afraid about surgery, afraid about to have pills of the rest of his life, and uh, uh, he's so happy when I offer her the opportunity of do a innovative treatment at that time. Was almost 4 years ago. Was one of my first patients in Brazil, and her nodule shrink on the first 3 months 30, and he was so happy. It's so important to us to see how the patient is grateful for the result of her treatment, and it's caused a great impact to me, and I start to think, yes, this treatment worth a lot for the patients.
Fantastic. When we say the words say no to thyroid surgery, but in the context of ablation, what does that mean to you as a surgeon?
Well, it's a chance for the patients to preserve uh, the quality of life, the treatment, avoid general surgery, avoiding scars in the neck, and avoiding hospital stay. Radio frequency ablation or microwave or any kind of ablations represents a game change in terms of thyroid nodules treatment.
You said the word quality of life. It's
Yes.
true. When a patient loses the thyroid, life is never the same. I speak about that from personal experience. And that may be one of the main reasons you offer ablation. But I want to ask you, as a surgeon, not every surgeon, thyroid surgeon, offers ablation. Why do you offer ablation?
Because I was very concerned uh, about how I can offer the best for my patients. I take contact with thermal ablation therapies in 2014 for the first time, and since then I started to use to learn and research and give contact with the key opinion leaders in that therapy, and I started to think, wow, it could be a very good option for many patients that wants to uh, uh, avoid surgery, because many patients postpone the surgery because they are afraid of surgery, they are afraid of lose their quality of life.
Good. It's great to hear a thyroid surgeon who can offer an alternative that is no surgery. It might be counterintuitive to some people listening, but it's great. Um, with that being said, what are some world trends right now that you are seeing in regard to thyroid ablation?
Well, this therapy is growing fast, very fast in the world, because many and many doctors are interested in to offer this modality of treatment for their patients, and it's important to say the patients are very aware about this opportunity of option. So many patients came to me and say, "Oh, where I live, or in my city, or where my doctors don't offer this possibility of treatment for me, and I saw in the internet that it's a very good option. So I start to research where I can do this treatment. Uh,
Yeah, I think we're seeing that more often where patients are becoming their own best advocates, and they're taking their care into their own hands and researching what their best treatment is. And they're even willing to travel in many cases to save their thyroid.
I have to say that, of course, South Korea is the the country where RFA started. But now we have many countries that can have very experienced doctors that offer this. South America, for instance, we have very good ablation centers in Brazil. We have many doctors in Brazil that now are performing RFAs. We have in Ecuador, in Colombia, in Argentina, in US, of course, in Mexico is starting, and many countries in Europe, Italy. Italy, it's a great center of, you have many universities and hospitals that offer this treatment. And France and Spain, Turkey, you have very good surgeons. Egypt, we have many countries in the world, and even more doctors are being trained to offer this treatment for their patients.
Okay, Dr. Volpi, for the patient, what are the risks with thyroid ablation?
Complication, it's the voice changes. Even though these changes are very rare, permanent, and it's very uncommon you have this kind of complication. It's the most common complication when you perform RFA. That's that's why we should talk with the patient during the RFA to, because it's to see if everything is fine with the voice of the patient. But when you compare the risk of voice change with when you compare the risk of voice change between RFA and conventional surgery, the risk of RFA is it's minimal, but it can happen. It's the most common complication. Well, the RFA, the recovery, it's very fast. Usually we have need just 24 to 48 hours to total recovery of the patient. Usually the first, in the same day of RFA, the patient needs to rest. But in the day after the RFA, the patient, many patients back to the work, and in 24 hours, all the patients have almost 90% of his life totally recovered. It's very fast when you compare with other modalities of treatment.
Okay, great. If a patient wants to get thyroid ablation, how should they go about selecting the best doctor?
Wow. I suppose he have to research about the doctor that will perform RFA. I suggest to go to RFAMD.com and see the profiles of the best doctors. And it's interesting because I have the opportunity to treat patients of other countries than Brazil. We already treated patients from almost all over South America, and the patients from Europe also come to Brazil to do their treatment and preserve the thyroid.
Wow, that's awesome that patients take their health so serious that they want to save their thyroid, preserve quality life, avoid surgery,
Yes.
and they're willing to travel to other countries in order to do so. Um, I think it's important for patients to hear that not every doctor is using ablation. And how do you describe, what do you tell health professionals who are skeptical of ablation or resistant to the technology?
Well, uh, it's an interesting question because many of my patients uh, talk with his doctors about the possibility of this treatment, and we are spreading this knowledge among our colleagues in presentations, showing our experience in papers, presenting our many congress, and proving the uh, reliability of this treatment. And of course, it's when you the medical community. But I have to say that we are in a very good path because and many doctors are interested in to to train this modality, to get acquainted of this modality of treatment, and we are very confident that in few years the RFA will be very common in the practice of most doctors that deal with thyroid in his daily practice.
You know, Dr. Volpi, right now we're at a time in history where innovation technology is moving so fast. And sometimes it's moving faster than regulation and policy. Can you think of an instance
Yes.
where you treated a patient in a way that guidelines would have recommended something different, and you chose to use ablation as a form of treatment, even though guidelines might have said surgery? Can you think of an example?
Well, I suppose the best example is the micropapillary thyroid cancer. Uh, Even though this modality of treatment it's not in the guidelines yet, many research and many papers in the medical literature are selected patients. In our practice, we have treating these patients with initial papillary thyroid cancers, less than 1 centimeter, with very, very good results. So I suppose this is a good example. Uh, uh, another very good example is toxic nodules. It's very good how we can treat these patients with excellent results.
Awesome. How about this scenario? Have you seen a patient who went to a doctor and the doctor said you have to do surgery, and before they did the surgery they came to your office and you said, listen, you don't have to do surgery, you can do ablation instead?
In my practice nowadays, of course, as many patients come to my office for a second opinion, and after see the patient, do the ultrasound, and do analysis of the case, I can offer radio frequency when you do a surgery, you take out the nodule. When you do ablation, you kill the nodule, and slowly the nodule will shrink day after day.
Fantastic. Okay, Dr. Volpu, now we're kind of coming to a close of this interview. For the next series of questions, they're rapid questions. How much does thyroid ablation cost in your office?
Of ablation in my office, it's about, with all the costs, with the clinic, equipment, and anesthesiologist, and in my time, it's about with all the costs is about $4,000.
Where do you see treatment for thyroid cancer going in the next 10 years?
Well, it's important to understand that now most of thyroid cancers are thyroid cancers are diagnosed with less than 1 centimeters. So for these patients, we can have nowadays 3 strategies. You can do just active surveillance. Many patients don't need any treatment. It's just an active surveillance. Many patients should go to surgery, but for not a total thyroidectomy, but partial surgery. And many patients are good candidates to to thermal ablations. And ablation, it's a very good option for small cancers.
Mm-hmm. Okay, lastly, let's talk about doctor-patient communication. How do you communicate to your patient who has been diagnosed with papillary thyroid cancer?
Well, when you have the diagnostic of a micropapillary thyroid cancer, usually we say to the patients that, of course, it's not a good news, because cancer is always cancer. We cannot forget this. There is no good cancer. All cancer is cancer. But the good news is that you can treat the cancer with a very effective way, preserving preserving his thyroid, preserving his quality of life, and with minimally invasive treatment that can avoid a hospital stay, with a short time of recovery, and with very short time to back to his life.
Fantastic. Dr. Volpi, before we say goodbye, any final thoughts that you would like to share?
Yes, I want to say that radio frequency. I want to say that thermal ablations are a very good option of treatment. He should be performed by experienced doctors, and we have the patient, the right patient, the right disease, and the right doctor to have a very good result with with the treatment by thermal ablations. Nowadays, the indications are expanding, and we have even more doctors that have all the need.
Fantastic. Listen, thank you so much for your time today. It was great seeing you.
It's a pleasure to be here. Thank you. Thank you for inviting me.
Farewell, Dr. Volpi.
Thank you.